Hey, what's going on, y'all? My name is Rene Garcia, and I am the creator, founder, owner of Men Do Therapy. So I'm really excited for you to be here today, and I wanted to do just kind of a quick intro video about what this whole thing is and what do I hope to eventually get out of this channel and platform. So a little bit about me. I'm originally from Houston, Texas, and right now I live in the DFW, the Dallas area. Here in Dallas, I am a mental health clinician licensed in the state of Texas. So I have three different licenses, okay? So the first one is a marriage and family therapist, a professional counselor, and the last one is a chemical dependency counselor. I have been in the mental health realm probably since about 2010 in some shape or form, whether it be like an intern. And then even before then, I guess waiting tables and bartending, I always call my first therapy gig. But in these last 10 years or now 11 years, I've worked in various levels of care, such as inpatient, where people are pretty significantly ill, medical hospitals, psychiatric hospitals, as well as residential treatment facilities. And then I've also worked in outpatient settings, such as intensive outpatient programs. And currently right now, I actually do have a private practice here in the North Dallas area. And one thing and one phrase that I have heard consistently since I have been in this work is the phrase, men don't go to therapy. I cannot tell you how frustrating hearing that phrase is for a number of different reasons. Number one, I just think it's not true. Being in the different levels of care that I've worked in, I have always seen individual men not only be in those programs, but also do very well. I think another thing that makes me quite angry is who is saying these things. I hear them from friends. I hear them from family members. I actually even hear them from colleagues, which is probably the most disturbing one. And so one thing that I think bothers me the most about this is that I actually feel it's not helpful at all. It actually isn't helpful to men in general. And like I said, when I was doing talking about my different levels of care and I worked in and things like that, I opened my private practice a couple years ago. And one thing they tell us as therapists is that you kind of have to specialize, right? You can't just be a run-of-the-mill general therapist. There has to be something that people can attach your name to. And I've had my private practice open for a couple of years. And although I had some really great referrals, I didn't really have something specifically that I had to put my name on and what I think people could refer to me for. And so I want to say end of 2019, I really wanted to update some marketing and some different things that had related to my private practice. And I kind of had to take a step back and say, who is coming to see me? Like, what is my clientele? Well, if I looked at my clientele at that time, I actually had about 75 to 80% of my clientele being individual men. And so what I did with that is I said, you know what? Okay, what can I do to build off of this? And I decided to, in the beginning of 2020, make my practice primarily men's servicing. In other words, I wanted to sit here and say, if you had a man, an adult man that was wanting to get treatment, Rene's the guy to go refer him to. And I started that in 2020, and I would say by now, and here we are in April of 2021, I'd say probably 95% of my clientele is individual men. Especially my favorite is the men that you don't think would go to therapy, the people that would get that label of men don't go to therapy. I have a whole practice of those guys, and I'm very proud of them, and I'm very proud of the work that they've done. And so what I wanted to do is I wanted to say, now what could I do to build on top of this, right? What else can I do to expand this platform? And to sit here and say that I'm the first therapist to do this is a complete, utter lie. This is simply my version of something a number of awesome clinicians and coaches and people who just want men to get better have done. And it's creating this channel, right? Whenever I hear the phrase men do therapy, I think of it as two different ways. Number one, it's a statement, right? Men do therapy because I think it's true. But the second part is actually a little bit different. It's actually a challenge. It's saying men do therapy, right? Whenever anybody comes into my therapy room, I usually tell them a couple of similar things. Number one, there's a lot scarier places to be than a therapy room, okay? So that's number one. And then number two, this is a place to be comfortably uncomfortable. I want people to come in, and it's going to be a little bit different, but it doesn't mean that it's not going to be safe. And that's what the therapy room is all about. And I want this to be a way that we can focus on the betterment of men, right? It's no surprise or no secret that the last 10 years, especially with the development of the Me Too movement, is that, we have put a big microscope on men's actions, men's behavior, and men's power. And one thing that I have consistently kind of been looking for whenever any, allegations or anything comes up in these high public figures is, we focus so much on the actions, but we don't ever talk about the betterment. And in fact, no one really wants to talk about the treatment. We just want to identify and then move on. And I think, if we want to have better men, we have to focus on their betterment. And I want this channel and this platform to be part of that. Am I sitting here defending actions or telling people that they're wrong? Of course not. All voices need to be heard, and we need to listen to voices of victims. That's one of the most important things that we can do at this moment. But I also want to focus on how are we talking about treatment. And I also want this channel to be things not just on public figures, but also statistics, studies, methods of treatment. And I really hope this is something that someone can get some value out of, because ultimately that's what I want to do. Is I want to make sure that if someone could benefit from therapy and they have any questions and things that they want to, focus on, that this channel could help them get to that place. All right. So I'm excited to do this, excited to take on this extra little journey. Hopefully we'll have some swag and some stuff that people can buy and get, get their heads wrapped around and represent the brand. You know what I'm saying? And then, of course, share, subscribe. All right. And I'm excited to do this whole thing with you. Please leave any comments, send me a message of some things that you want to maybe talk about. And I look forward to, doing more and more and more of these. All right. Take care.